video, we're going to talk about stretching a quad out after a knee surgery. I typically see people struggle to get that range of motion, that end range flexion in the knee. Now, on top of that, when they're trying to get a prone quad stretch, so stretching the quad out in prone, it really aggravates the anterior portion of the knee. So you can see in this person, we bend her knee up, and it just kind of, she just had a little twitch, a little jump. It just doesn't feel right in the front portion of the knee for her, maybe even in the back portion of the knee. But I still want to get a good prone quad stretch because she did have an ACL reconstruction. So what we'll do is we'll have the patient go on her stomach. I'll prop her up into hip extension, and then I'll try to stretch her quad out. And you can see here, she kind of shifted a little, so it probably doesn't feel good. So what I'll do is I'll take my hand, put it in the crease of her knee, and I'm going to give a little pressure into the tibia essentially, and into the gastrocsoleus complex. And I'm going to try to stretch her out, and you can see it's a lot more comfortable, so we can get more range of motion, and she's not feeling as much pain most likely, right? Feels better? Yeah. So she says yes. So again, that first bend without my hand there, oftentimes they feel it in the front of the knee, or even sometimes a pinch in the back of the knee. Put my hand in the crease of her knee, stretch it, give a little pressure to the tibia, gastrocsoleus complex, and then get a nice stretch. They oftentimes feel a nice stretch in the front of the knee. I think it's by changing the position of the tibia. There might be some tightness in the capsule. You know her knee is probably not at homeostasis, as Scott Dye talks about. So if we can just change somehow the position of the tibia, I think we can better isolate a quad stretch. I think you get better outcomes for your patients.